Good evening, Boachem Leshalom. It's a pity to stop this beautiful song. And so, Boachem Leshalom, Dr. Ba'arav, Leon, Tuesday 8 to 9, and with our Pina, our show of Dr. Ba'arav, doctor psychotherapist, right? And correct me all these numbers.
Psychotherapist and doctor of clinical hypnosis. And I'd like to say to listeners, first of all, sorry for last time. We had some problems with the phones, but please, we got a lot of feedback, and a lot of feedback in the office. So I welcome your questions. In last week's topic, we got a lot of calls that didn't go through, so please, you can reach us at 718-683-5858. The main topic that we'll continue to discuss, because of the importance and because of all the feedback that I got last week, is in terms of leading people the right way and how important it is, and the most important when people have issues, whether it's physically, psychologically, emotionally, to treat the actual root of the problem and not the symptom. And the people should be aware of that, and to know that yes, there's no such thing as going years for therapy and not seeing results, years for treatment and not seeing results. It's very, very unfortunate, and we're trying to lead people the right way and to really understand, and we'll get into more in depth in terms of treating the root and not the symptom. Now, there's different ways to do that. And I'd like the callers to please call in with different situations, and we could even explain it according to your situations or situations that you're interested in, how and what really are we looking for to treat, to solve the root and not the problem. I'm going to go through a few situations and explain what is the right way to go about these treatments. Okay, first of all, let's say somebody's going to have a problem with fears. Somebody is going to have a problem with fears. What are you going to do? Somebody came years ago, they're going to have 12 fears. So you're going to start dealing with every single fear, or are you going to look at, wait a minute, why does this person have the fears? It's important that the listeners should understand that we have to look at the whole problem, the diagnosis, consultation. The first time that you meet, with the doctor is very, very important, because it's like a sugya. It's like somebody, you look at the tail of an elephant. You want to see the whole entire picture. What are we talking about? And, we find the same thing in Chazal, that, if we'll have time, I'll give some examples. But the Gdolei Yisrael, in a lot of their decisions, which are sometimes difficult for the smaller people to understand, but they really looked at the whole picture. They didn't look at the here and now. They look at generations ahead. They have to act accordingly so the generations ahead are not going to make certain mistakes. And that's a lot behind a lot of issues that hopefully we could one time get to. But to get back on track, we have to see the entire picture. What is happening with this person? We had a situation a number of weeks ago where a lady called in that for 30 years had a problem of injuring herself, scratching and, mutilating herself. And, Baruch Hashem, just came into my mind to ask her, well, when does this happen? Does this happen at certain times? She says, yes, it happens only when I get nervous. So right away, I said, okay, I want to hear from the listeners. What is the answer over here? I want you to think logically. It doesn't matter the doctor has degrees, the doctor's name, like the lady called last week. She was referred to somebody, for Shalom Bait. And, after 3 years and whatever money was lost, no result, I told her, it's really a shame. And this is really why I'm here. And why we're all here is that these things shouldn't happen, and people should be educated in terms of what to expect and what not to expect, and to know if you're not on the right road, you don't have to be on the wrong road that's going to lead you somewhere very bad. You want to recognize that and get back on the right road. Okay, so looking at the whole picture, we heard that lady was mutilating herself, and we also hear it only happens when she gets nervous. So it's true. The problem is that she injures herself. But the truth is, to solve this problem is very easy, and I really want the listeners to relate to that. Yes, if she doesn't have anxiety, it's not going to happen. So we don't care about the problem. Of course, that's the most important thing. But if she doesn't have anxiety, it's not going to happen. So not to focus on what's on the symptom, but to think a little more in a flexible way, with a little flexibility. How do I get rid of this problem? Okay, there's a way to disturb the disorder. If she doesn't have anxiety, then this tendency, whatever deep things are behind it, that's going to take 10 years, 15 years, a whole life, well, she can solve it literally within a very short time. A number of weeks, she would definitely see results, and she would be finished treatment definitely in a couple of months. No question whatsoever. Okay, and Baruch Hashem, she is getting better, this specific caller. Because if you get rid of the anxiety, even that's not why she's coming, but then the problem is not triggered. So this is why it's very, very important that as individuals, to have a diagnosis, looking at everything the person is going through right now. Don't go into the past so fast. What is happening right now in the person's life? What stresses? Like I was speaking to Leon, just before. If I'm going to get rid of, let's say, I gave the example of somebody who has like 12 fears. So I right away, wait a minute. If it's one fear, but you're not talking about phobias that are basically working differently, you're talking about certain fears. Now, for fears to exist, you have to have a pretty low confidence, and the lower it is, the worse are the fears. So if there's 12 fears, so if you build up the person's confidence, the fears are going to slowly disappear, and that's exactly what happened in that case and in a lot of cases. The person's like, wait a minute, I didn't come for this. I came for fears. Why are you building up my confidence, my perceptions? Do you realize this is, I came for something else? It's true, but we're looking at how to solve it. We're talking about people, they're going to a doctor, to a therapist. There's a lot of trust here. Like Nissim spoke last time, you need to have Ira Shamayim. You have to know when you don't know something. There are, certain cases that are pretty rare, but there's specific things that I do not accept. And if there's a doubt if it's one of them, in fact, there's certain cases I had recently, I'll be very honest with the person that if it's going to be this thing, we're talking about a different category of problem. So it's very, very important that, that the listeners, you're going to a doctor, you're trying to get help, but it has to make sense to you. How is this going to work? You want to get rid of the root of the problem. The root of the problem has to be identified. How is that going to be solved? Now, be more skeptical if they're dealing specifically with the problem, because most times the way to treat it is not to deal with it specifically, but in most of my treatments, it's indirectly things that are going to cause the problem. What are you going to do to disturb the disorder? What are you going to do if there's, like, for example, somebody has OCD? There's a way that, thank God, a new innovative technique that will actually disturb the way OCD works. Now, if somebody's going to work with, this person washes their hands, so you have to understand that's not the problem. The problem is OCD. And people will make the mistake and they'll go to cognitive behavior therapy for 20 years, for 10 years. I don't mean to knock down any treatment, but treatments should basically, if they're hitting the root, the results should be lasting. And there is a way to disturb the actual OCD that in my treatment, I don't need to know what the OCD is. I don't need to know the category. Is it a thought or different thoughts? Is it checking? Is it repeating? Even the category I don't need to know. So again, the client is going to ask, wait a minute, I came for this problem. Why are you doing something else? Because the thing that I'm doing is going to basically disturb the root, which is OCD, from occurring. I'm not interested the way it happens. You want to solve the actual root of the problem. Okay, so if there's any questions so far, or any situations, please feel free to call 718-683-5858. And again, my office number as well is 718-621-2179.
Yeah, we're waiting for the caller to call. So, you know that last week we had a very, I would say, interesting show. I know that some people was upset that I'm just a little bit too much talking. And
oh, that's very good. How did you find out about that? I was too scared to tell you.
It's okay, I know.
Too idle, maybe.
So, but I think it was very interesting show. And that's all idea. The whole idea that people will learn and say, feel, confidence to call and to understand what is all about, psychotherapist. Because, as you said, you have so many nonchalant.
It's also, I think, something really, really important is like this. That the truth is that it's even more than that, because if somebody has a problem, so they basically, that's how they understand it. In other words, I have a problem, somebody comes to me, even at, at this moment, so I'm treating one or two people, someone comes, they have a problem socialization skills. Actually, 2 clients, okay? And this is why they're coming. So, right away, according to everything that I heard in the consultation, that you're good in this, you're good in that, the confidence is not so bad. From everything I heard, that I really don't think that to work on the skills of socializing, that's exactly what is the wrong thing to do, because most people, once they get to a certain level of confidence, they get more comfortable, and if they're intelligent, they're verbose, they're friendly people, and one of the people even gives drushes, and that doesn't make any sense. So again, you're basically telling the doctor what to do, and you do not want somebody who's going to go along with you, because that person is supposed to be working for you. Just like you're going to have a certain lawyer, and that lawyer is like, listen, I'm working for you, and you listen to what he says, even though it doesn't make sense to you. You want somebody not who is going to really take things in their hands. They're going to diagnose you properly. Wait a minute. What needs to be done is to increase the confidence, and then you're going to it's going to become easier to socialize. And you start treatment. It took about 3 treatments, and person begins to see, hey, they're a little more comfortable with people. They're not finished, but it's starting. Thank God. I would be happy if it was start after 6 times as well. But it's starting, and the person sees, and all of a sudden they start to understand, only once they begin to see results, hey, I don't understand how this is working exactly, but all I know is something is happening. And a very important point is that, number one, like we said, the person has the tendency, this is my problem, so treat this. But sometimes, and most of the time, we have to do it indirectly, especially when we're talking about tendencies, predispositions, that I'm gonna get phone calls from doctors. Wait a minute, a person has anxiety, a person has a tendency for depression. What? It's a predisposition. You're gonna go in the subconscious mind and get rid of a predisposition, a tendency? Yes, but I'm not gonna do it the way they think I'm gonna do it. I'm gonna do it differently. And so that's one point. The other point is the fact that you're doing in treatment something that is completely nothing to do with the person's problem, besides the most important thing, it disturbs the root of the problem. In other words, somebody's coming for social skills, and I'm not even mentioning that, I'm just building up their perceptions, their confidence, all of a sudden social skills get better, you see it's real. Somebody's coming from OCD, and I don't even know they're OCD, and I don't even mention anything about OCD, and slowly the OCD and anxiety that comes with OCD begins to become better. Hey, wait a minute, how could that be? First of all, becoming better is great, but without even mentioning it, that shows you the truth of how real it is and how real it's working. Okay, so that's also something, very important. Like I was speaking with Leon mentioned on the way here as well. Somebody's going to even work on your confidence. But you know what? What happens if you don't see results within a month, within a month and a half? When I say results, I don't mean finishing, I mean beginning. It's starting to work. Like I said last time, you don't give it, years to start to work. You give it literally weeks. You want to give it 2 months. Last time we said 3 months. In difficult situations, some things work, much faster, but to give a certain amount of time and to begin to see results. If something like confidence, which really should begin to work, doesn't work, that means that something is missing. And usually, you have to look, wait a minute. If I'm building somebody up, if I want the fears to go away, if I want fears, worries, doubts, decisions, they accept compliments easier, they take negativity in a lighter way. So the first thing is the sur mara, getting away from the bad. Is there something knocking the person down? Very logically, the confidence is low. Maybe it happened naturally, or maybe they went through a trauma. And that trauma, by the way, whether it happened, whether something happens in a traumatic way, like a sudden way, hard way, or criticism over time, this builds up in the subconscious mind. And this has to basically be redefined, and basically we have to remove this, take care of this, which could be done, believe it or not, pretty easily in a few treatments. Which we had cases that we could, if I have questions about it, I could answer it later. And only then are they free to get to the root of the problem. Okay? Sometimes, people will come with a shalom bite problem. So then again, this has to be, at least, I'll always put aside extra time for certain cases. An hour is the minimum. Most cases, some cases could be a few hours. But the most important thing is that we see the whole picture, that we understand everything that is happening. And even then, we have to basically, we have to deal with some other points. But the first thing is we have to know exactly what is happening. There's no right, there's no wrong. It's a matter of how do we solve this. That's number one. Number two, in a lot of very severe cases, people, and again, we're just giving a little bit, it's a topic in and of itself, but I just want the listeners to have like a little bit of an open mind to certain ideas that might be foreign. But difficult cases where people might have went for a long time or to many different people, and they really both want, but they didn't get help in the shalom bait, and it's not working. So there is something a little deeper that is before shalom bait, and that's going to be something called anchoring or classical conditioning. In other words, it's like if you had a very bad experience with a certain person, if you just look at that person or see the lines on their forehead, it's going to register in a negative way. And we have the opposite. You could be walking on 13th Avenue, you see, your friend from the back, you see his or her red hair, you know it's them, and they're the biggest joker, they make you laugh, they have the amazing jokes, they make their own jokes. You just see them from the back and right away you start to smile. You didn't even talk to them, you didn't even walk up to it. Because the person is, is associated in a certain way. And in very, very difficult cases, what happens is, because of all the troubles and all the negativity and all the fighting, whatever is going on, so the person becomes negative in the spouse's mind. So if a therapist says, hey, come home with flowers, is going to tell him what to do, is going to tell her what to do, it's swimming against the current of the negativity in the spouse's mind. And it's a little bit like torture, because the person's trying so hard and L'Shem Shamayim, and they want it to work, but it's not going to happen until the negativity is at least even and they have a fair chance, especially couples that really want it and are working for it. And that negativity is the first thing that is done in hypnosis, in in the cases I deal with, specifically in the very difficult cases, because you don't want negative associations. You want to be even when you're starting, and then you want to build up positive associations. So that's why sometimes it could be that, for any of the listeners who are in such a situation that you've tried and that, it didn't work because the spouse, they see you and you see them, the other side, in a negative way. So that's basically swimming against the current. Then once you get past that stage, then there's the level of the right diagnosis. What needs to be done? No right, no wrong, but how is it affecting the other, the wife? How is it affecting the husband? Again, I didn't do anything. No, it's a matter, if it's affecting them, it has to be dealt with. Okay, these are just some ideas. And again, please, you're welcome to call 718-683-5858. And you're listening to Dr. Baharav at 621-2179. 718-621-2179 is my office if you have a more private call, or you're afraid to call, or for any other reasons. Okay, so if we have any questions.
First of all, I want to say the text number 347-927-8398, 347-927-8398. Doctor, I have a question.
Yes.
Again, I'm throwing you a little bit to the outside. And first of all, it seems like from the person from the outside that today in our generation, first of all, it's like almost like a fashion to go to a therapist. I am with a therapist, so it's like a stigma, and you go like this. I can stay over there with him 20 years, and it's good for the business and good for the therapist and all this.
So this is exactly what we want the people. Again, we want the people to understand this, and that it should not be like this. And if your friends are like this, whatever it is, or you don't have what to do with your money, fine. But if you're somebody who's suffering and you want results, so you have to know the truth. There's a very big difference between a friend, between, again, we see the Gemara, we see Rashi, Daga belevish Yisachena, Yaserenim Liboy, speak to somebody about it, take it out of your mind. We're dealing with problems on a certain level. You speak to your friend, you go to a therapist. Here we're dealing with, real, serious issues, to such an extent, one of my OCD clients said to me, and I think this is from the first times I've heard it, and I've been doing this for a long time. He said to me, in terms of OCD, he said it's worse than that illness that we don't describe. The first time I ever heard that. Because again, there's levels. Some people are really, really suffering, and these are the people who, fine, you want to be a famous singer, an actor, you want to go to a therapist every day, you want somebody to talk to, fine. I'm sorry, we have a text. But in terms of getting help, that's a different story. We have a text.
Can hypnotism side effect?
Oh, we have a question here. Somebody texts, can hypnosis have side effects? Is it dangerous? Okay, so first of all, 1 second, we have a little more here.
It's a different. I am a confident professional consultant. I run a large meeting and deal with people as well. Yet I cannot make a small talk at a wedding or convention, I end up sitting alone with no conversation. Can you help? This is amazing, you know. This is what you spoke about before.
Yeah, exactly. Okay, so we have a few questions. First of all, I'll get to the second one soon. I appreciate you waiting. Okay, but in the meantime, when you're dealing with hypnotherapy, you're not really running into much of you want to have somebody, first of all, who knows what they're doing. You're dealing with something very, very complex over here. Just to give you a few little examples, if I'm going to be dealing with a businessman, my words will be different. I'm not going to say anything negative. If I do a treatment for certain things like pain or OCD or anxiety or whatever I'm going to basically doing, every second is calculated. Are you too deep? Are you not deep enough? Are you in the second level? I'll bypass the critical faculty. I'll get to the subconscious mind in two ways, not one way. You're dealing with something very complex, and then you're dealing with the whole topic of what we're discussing, of getting to the root. So, it doesn't even, and even if the person even under hypnosis, he could just be relaxed or she's relaxed. It's something very complex, so you really need somebody who has a lot of experience. One thing is being an entertainer, and the other thing is treating. In terms of dangerous, there are deeper levels. The third level of hypnosis, called the Estelle state, called the coma level of hypnosis, by the way.
That's what we talked about last week about it.
The coma level of hypnosis. First of all, to get somebody out of that, in terms of danger, there's no danger. Somebody's coming to me. I don't want them sleeping, basically. They're not getting out of it because they enjoy it so much. That's what's really happening. People think they don't have control. They enjoy it so much, in such a deep level of relaxation they never in their life had. It might seem like it's a danger, but they're really enjoying themselves. They could stay like that for 8 hours and have people waiting to be treated, and I can't have them there. You can get somebody out of that state in a few seconds. There's tricks of how to do that. You have to know what you're doing. But it's extremely rare. I think it's 1 out of 10,000 somebody's going to get to that level. So, yeah. And anyways, you don't work on this level. Suggestions are bad in this level. So if you're treating somebody, you're not dealing with that level at all. And, in terms of, I'll answer for myself. I don't like to mention in terms of others. But there's no danger in terms of the actual treatments that I do and the actual hypnosis. It's very relaxing. You hear everything. You know what's going on. And you have total control. Okay, and now to get to the second question, which is very interesting. We're dealing with somebody who deals with people, is a consultant. And he's intelligent. He gives seminars, or he speaks in large meetings with people, and
you cannot speak to a wedding or
in weddings or certain conventions.
He sit alone, basically. They found himself sitting alone.
Yeah, when it comes to small talk, so then it's going to be difficult for him, and. Okay, so really there's a few directions I would need to hear a little bit more. If you would text me like a little bit more, I would need a little more information in terms of the route to take, because, in terms of your confidence, I want to hear about that. Even though you're speaking to a lot of people, but sometimes it's going to work in interesting ways. It could be your nature. Just that you're technically the way you're thinking. It could be in terms of, certain levels of confidence. I need to hear a little bit more details, like how your confidence is. Is it just like annoying for you to have small talk? Or is it something that you really want to be able to do, but you can't do it? Something's interfering with that. Is it like a fear that you have? Is it just something that is not your personality? So I need to hear a little bit more, because again, just like, I was saying, we have to hear and see the whole entire picture, because there's a few directions that I can answer this question, and I just want to answer you properly. So, either you could text us a little bit more, or you can always feel free to call in. You could call us at 683-5858. Or if for some reason you want to speak about it privately, the office number is 718-621-2179. It could be that you might have had certain experiences with, certain people, and it might be certain associations. If everything else checks out and you're confident and you're speaking publicly, or again, could be just your personality is not into small talk. So it's really we have to get a little more information, a feel around what is disturbing you from the small talk. It does help that you gave the information that you give seminars and you could deal with a lot of people, because that shows that there's something else. It's not so simple. It might tend more in terms of a fear, or that something happened to you which is treated more like a phobia, or just that you're a more technical type of thinker and it's hard for you to beat around the bush. You're used to, it's just not in your nature as much. So, these are some of the realistic possibilities from the limited information I have.
You're asking if you can help.
Yes.
Question if you can help.
Yeah, it could be helped, definitely. And it doesn't seem like you're so far away because of how you are able to communicate with large groups of people. So it doesn't seem like you're so far away. It could be just a matter of, small talk that you're not used to, or, a fear or phobia because of some bad experience that you might have had, or you might think that you'll sound awkward speaking like that. So definitely it could be helped, and I don't think you're so far away. I think that the way it's affecting you is far more than in terms of helping you, which I don't think is something too major, too complicated to solve. I think that it is major in terms of what you're experiencing, and I sympathize with you. But in terms of solving it, I sense that it's not so complicated, because the confidence cannot be too. Okay, I hope this answers your question.
It's leading me to a question about stuttering. Is hypnosis helping,
Very good question. Basically, my experience, I would do 2 sessions and see if it's yes or no. Afterwards, I don't know if I would deal with it. Because my experience was actually when I was still in yeshiva, and before the doctrine, I took just like a few courses, and I actually, hopefully he's not listening, he might scream at me, but a friend of mine actually was a stutterer, and he was by his brother's Sheva Bechot, he wanted to speak, and I told him to sit down, and I did a treatment, for stuttering, and I did end result imagery for him speaking, and then he came back from I think 1 or 2 treatments I did, and they had him recorded on tape. He played it for me. Perfect. And I was shocked. Like, how could this be? How is this working? I wasn't experienced enough, and I didn't learn enough to, realize. So the real answer is going to be like this. What I would do is I would basically 2-3 sessions max. Because if it's going to be so simple, you're going to see it literally by the first, second, third session the most. If you're not going to see it, then you're dealing with something more deep. The percentages, 50-50. Much less than everything else that I do. That's probably something that I would take. I would take such a client because it could go both ways, and straight out I'm saying 50-50. It could be very deeply rooted and complex, and that would probably be something that I would not take, because I don't know how successful that would be. But lekatchila, in the first place, I would explain this to the client, and I would take them because if hypnosis is going to work, you're going to see it almost immediately. By the first, second session, you should have major percentages. Otherwise, it's more deeply rooted. It's very interesting. When stutterers sing, they don't stutter. Did you know that?
Yeah, yes, I heard about it.
You heard about that, right?
Mm-hmm.
And in fact, if you tell them, okay, I want to hear how you stutter. Yeah, just I want to hear. Just say something. I can't. What do you mean? You tell me you stutter. What? Say something. Stutter. I want to hear it. It also won't work. Mm-hmm. So it's a fascinating topic. Unfortunately, I'm so busy with other topics over my head that I did not go into depth with this topic, and really also the demand and the amount of people suffering. I didn't go into depth in it, and I'm sure there's like discoveries in terms of really narrowing things down. But in simplicity, if you see the results, I'm going to want basically right away, within 2-3 sessions max. If I don't see results after one session, even nothing, I already get a little bit concerned. But by the second session, I would tell the person, before we even start, this is what I want to see. Otherwise, you're dealing with something a little bit more complex. Or at least to tell the parents that, or to tell them, straight out. This is my experience with it.
Okay, so I'll lead in another question. Some people has a tics, like unconscious tics.
Okay, so again, very good. In terms of, let's say, tics, in terms of even something like Crohn's disease, in terms of like there's also rare illnesses and all types of phone calls I get. So you got to understand one thing. It's not a matter of being an expert in Crohn's, which I'm not, but the first question you're going to hear from me, if I get a phone call... I'm sorry? Is a problem? Yeah, if I'm going to get such a phone call, so the first thing is, okay, when is it worse? Oh, it's worse when I have anxiety. In other words, how am I going to solve this problem? Or let's say in this case of Crohn's not solved, let's say, how am I going to help them? Can I help them? Well, if there's something that I'm not going to treat them for Crohn's. This is not what I do. But if there's something that's making it worse, like anxiety, which from most of the calls, that's, what I've been hearing. So then, yes, the Crohn's will get better, not because I'm treating that, because I'm making the anxiety better. And that's how this illness is working. So they'll get better because of the anxiety being less, and that will indirectly make them better. And that's very, very important for the listeners to hear. You don't want to look at your symptoms. You want to look at the root of the problem. You will have a difficulty to see the root in most cases, and will not, like we hear here from Leon here in the audience, that you will not be able to do it. And I agree with that. You really need a very thorough diagnosis to know how, not only the root of the problem, but how am I going to go about this, like a detective? Okay? I knew that would get your attention, Nissim. Detective. Because I think by your questions, I think you make an excellent detective, honestly. But a detective, yeah, okay, how are we going to do this? Look, this lady mutilates herself. Yeah, but it only happens with anxiety, so let's treat the anxiety. Okay, this person has a problem with social skills. Okay, but if we increase his confidence, we'll take care of most of that. With OCD, with anxiety, with depression, certain levels of depression, you need the right diagnosis in terms of what is making this person tick. What are all of, the factors? Nissim also just mentioned in terms of tics, like I said, what makes this person tick. You have to be pretty alert to have that. Okay, so anxiety is going to make it worse. My experience, I ask the parents, in most cases you're dealing with children, when they're nervous, it gets worse. When they get angry, it gets worse. So I will work with that factor. Hardly ever will I deal with the problem, with the symptom, because usually, and it's very interesting, because That's not the root. It's like somebody, they have a virus or an infection, and you're seeing all types of symptoms. But imagine you're going to go about it that way, and you're not going to deal with the actual, infection. God forbid. You're going to learn the hard way because the person's going to get worse. Now, unfortunately, this is how Hashem made it, and we should say, fortunately, everything's for the best. But in our situation, when we're dealing with emotional issues, and the whole topic that we're bringing down, how people are, could be taken for a ride, how people go for years, well, the problem is not going to be solved. It might not get worse, like in terms of medicine, like we got to change our approach. Look what's happening to the patient. The fever is going up. They have to go to the emergency room. The doctors have to change their approach. We don't want, God forbid, people to, people are going to die, God forbid. Over here, we have very, very serious conditions that are simply not going to get better. Now, if in certain times the actual disorder is becoming worse, so that you can see, but that's not because it was, that's just because of how the disorder is going. But somebody who has a certain disorder, if it's not getting better, that means that they're not getting the root or disturbing the root or getting rid of a phobia that's preventing the person from dealing with the situation. But I hope this gives a clear idea. And we just have another text over here.
Yes. Do you treat with medication or hypnosis only?
Okay.
The question why I need medication?
Yeah. A question of, in terms of...
Do you prescribe medication? That's what
No. The question is, what I understand is that do you treat with medication or with hypnosis alone? This is a question like this.
Okay, we'll answer in a simple way and then in a more complex way. I treat with hypnosis. Okay, this is what I'm going to do. Half of my clients come that are already taking medications. Around half don't take. If they're not taking, I will usually, if I can work with them, which is in almost every case, I will not recommend that because they're coming to me and I'm going to work with them to get better. If they're taking medications and they're dealing with a psychiatrist, that is, something for them to, basically they need it and they should continue whatever the psychiatrist is giving them. I treat them and they slowly, with God's help, they begin to improve with whatever they're taking. And as they get better, they deal with their psychiatrist, and he's the one to decide in terms of, reducing the medication. But again, you have to understand, medication, I'm not against medications, because medications, if somebody's taking, you don't take away something that is important and is helping them. Now, if you can make the problem lighter, so the psychiatrist will see that they're doing better and they need less medications because they are better. The root of the problem is better. You're making them a healthier person, needs less medications, and the psychiatrist will deal with it accordingly. Now,
you found conflicts between psychiatrists and you? Because
not at all. I mean, the whole idea is extremely different because, first of all, practically this is how it works with the clients, and you want to solve the problem. If somebody is taking medications, so you have to understand what is happening, okay? What is happening is, in most cases, the person will not be 100% free of their symptoms. They will still be suffering, whether it's anxiety, whether it's OCD, whether it's depression. Now, doesn't that get you thinking, why is that? And that's really very important. What is happening is like this. The medication is basically helping to stabilize certain levels, certain chemicals in the mind, and which are affected by a disorder, whether it's OCD, whether it's anxiety, whether it's depression. Now, that disorder is not being treated. The medicine is basically creating what the mind is being interfered with through the disorder. So I will deal with the root. I will do something to disturb the actual disorder. And as the person becomes healthier and healthier, similar to a physical situation, they don't need antibiotic anymore. They take less of it. But again, everything through the psychiatrist, and it needs to be explained more thoroughly. But this is very important to know, that somebody who's taking medications, you have to know the actual problem is not being healed. And the proof of that is that you have a few situations. The last one I'm going to give is going to be a little confusing, but that's going to be the real proof that the triggers or the actual disorder has not been treated. What's going to happen is that if somebody just gets off of medicine without being treated, they're going to either have the problem's going to pop up right away much worse, or sometimes you have cases that are not as extreme, that, they got off of the medicine and hey, they feel great. Okay, well listen, the medicine takes time to get out of your system. Yeah, but it's already 3 weeks. You know what? It's 6 weeks already. The medicine's completely out of the system. I feel great. I feel amazing. I'm cured. 6 weeks, 2 months, 3 months. They're fine. This is great. Like I never had the problem at all. No anxiety, no depression. 4 months, 5 months, 6 months. Boof. Oh my goodness. It's back. What is going on over here? Now, the answer to this really is going to shed light and keep it in your minds, because it's really going to give you a very deep understanding of what is happening to people who have anxiety, depression, certain OCDs, but in a lighter form. Because what is happening in such a case is that basically there are triggers to anxiety and depression. In fact, one of my, like I always say, either I'm going to disturb a disorder by doing something else totally in the subconscious, or I'll build something subconsciously that's going to make everything you see and hear, your mind will take lighter, preventing the triggers of anxiety and depression and other conditions as well. And there's a whole other list of how to do things, in this type of way. Now, what's going to happen in the case that I mentioned last? Again, the person got off of medicine. It's 1 month, 2 months, it's 6 months later. They feel amazing. I'm cured, and all of a sudden, boof, it comes right back. So in that case, you have to understand the problem was never touched. The medicine was basically stabilizing certain levels of certain chemicals in their mind. Now, the trigger of the disorder was very, very light. So light that, it took quite a lot to trigger it. But once it got triggered, you got to understand that, Hashem creates, serotonin is created in the mind naturally. It's just the people that have something going against that, the disorder messes that up, and they need to take, and then they need more. Here, in this case of the 6 month, so once they took the medicine, their situation was stabilized. The trigger, their condition, was never touched, but it was so, it was more on the mild side. Therefore, when they were off of the medicine, they weren't faced with a situation that will trigger that mild depression or anxiety, and therefore it wasn't triggered until months later when they had a difficult situation. That's when the exact problem that they've had all these years suddenly came back and was triggered again, because it was never cured at its roots with all the time they were taking the medication, and it was only triggered months later because daily life wouldn't be enough to trigger it. Only a more intense situation would trigger it.
Okay, doctor.
Yes.
The time is flying. We have less than 4 minutes. And we have, what about weight loss? Very quick.
Okay, very quickly. We have a text also?
No, that's the one of the text, one of the questions.
Okay. Again, answering this in a very honest way, you'd never hear me talk basically about this topic because I'm very honest, and the way it's going to really work is when somebody under hypnosis sees himself, and this really gives a very good understanding to our topic tonight, because I could do something that subconsciously you'll see yourself as if you lost the weight that you wanted to lose. Your body will match that image, and the person will start to lose. Now, the question is like this: what is going against that? Again, somebody's taking medicine, going against that is this problem. You want to treat the person for this thing, but the root of the problem is going against it. That's why people are not getting anywhere unless the root is treated. The same thing here. 95% of people, it's not a habit, and they will not be successful with hypnosis and weight loss. And again, this is something that unless somebody's referred by a doctor and they're in danger, if they're going to be past a certain age, like 18, 19, I would prefer not to take that because I want to be successful. And 95%, if it's something that's life-threatening, the weight, their heart, so then I treat it, people over the age of 18 or 20, as a psychological problem. Why? Because eating is a friend, eating is a crutch, it relaxes me, it does this. It becomes so complex as the things that I've described, they become easy in comparison to all the factors that are going to be involved or possibly involved in somebody losing weight. If it's a habit, it's going to be like a miracle. Stopping to smoke, these things are pretty easy. And again, the results, you need to see it very, very quickly, or else don't start dealing with it. But with the weight loss, 95% of the cases are extremely complex, and eating is not just a habit. If it would be a habit, that means nothing is going against that very strong treatment that I did. The end result imagery of look at how you really are, you feel great, you look great, you feel good, and the person in their subconscious mind, that's how they are. Their appetite is decreased and they naturally lose the weight. But again, what's going against that? Is there? If there's not, you'll be amazed. And that's the 5%. Most cases, especially with people that are, past in their 20s or later, 30s, 40s, the older you get, the worse it becomes. There's a lot of things involved, and basically they need to be evaluated as somebody coming with, a client coming in, not just for weight loss, but we have to look at the whole entire picture. And I usually like to do that with weight loss only if they're, if it's a serious medical condition, because I want to only deal with things that I'll be successful in. Or somebody coming for weight loss, is not going to want to come in for months and months and months, and that's usually what it would take, because it's more than meets the eye in most cases.